I decided to do fat transfer to the breast primarily because when I first consulted with Dr. Mess, the implant felt really heavy, and I didn't really like the fact that on the size of breast I had before, you potentially see or feel the weight of it. It just didn't feel natural. I was having another procedure, so that we didn't need to do liposuction for the fat. So it seemed quite straightforward and sort of like I was doing it anyway, so might as well just do the whole thing. Dr. Mess did an amazing job. I could not have anticipated how well the fat would take and how even. I actually was prepared for sort of a bit of fallout because it did sound so experimental, but it was perfect, and it is perfect. You would never know. I mean, if I didn't tell my husband, he would never know. When I first had the augmentation done, the results were so subtle. And the funny thing about the breast transfer is I tended to accumulate weight in my midsection before, and after the fat was taken from my midsection and sort of replaced in my breasts, now when I put on weight, I gain like 2 cup sizes. So since I've been a little less strict with my workout regime lately, the last couple of, I'd say the last like maybe a year and a half less, people are asking me if I've had a breast job because my boobs have suddenly gotten much bigger. But it is very much, when I'm thinner, my boobs are smaller. When I'm a bit fatter, my boobs are bigger. It's better than your belly getting huge. The breasts feel exactly like breasts would. At first I felt like they were sort of like really full, but hard. And now they've softened and like they just feel like normal breasts. Like there's no implant, there's nothing about them to sort of suggest that there was any intervention at all. They look like breasts. They're just normal. The incisions for the fat transfer are pinpoint, parallel, right under where the breast sort of like falls. So you would never see it. It's very, very subtle. I mean, you'd have to really investigate, like lift the breast and sort of look around there's no slice, it's just a pinprick. The recovery was, I had another procedure done as well, as I mentioned before. So the recovery was, at first they were huge because of the inflammation from the cannula, so they were sort of up here. They were very impressive. But then after maybe 6 weeks they went down and they were normal. And again, the process is less painful, I imagine, than people would imagine. But it doesn't, you don't get your full results until sometimes, so just be patient with the process. From the breasts, okay. I felt fully healed within a couple of weeks, maybe 3. I have darker skin tone, so I don't bruise very easily, but I did have some blue and sort of purple bruising around the sort of the fat part of the breast on top a bit, but not severely. I didn't feel that it was a very violent procedure.